HOPA is a Hematology Oncology Pharmacy Association. We are a national association of pharmacy professionals dedicated to the care of cancer patients. Approximately 2,700 members are made up of our organization. We are approximately 14 years old, and we have a dedicated group of volunteers that help us move our association forward. The mission of our association is really to be there to support the hematology oncology cancer professional, not just pharmacists, but we also have pharmacy technicians in our association, as well as our colleagues in the medical and nursing professions as well. We have 4 areas of our strategic plan, which was just introduced in 2016. The first area is professional development, which is really the core of our activities right now. HOPA was founded in 2004 as a way to educate our pharmacy professional colleagues across the country in optimizing the care of cancer patients. And we do that through a variety of mechanisms. The main conference that we hold is every spring, usually at the end of March or the beginning of April. And last year we had just over 1,000 attendees come together for about 3 days of conferencing. The program focuses on not only the care of the cancer patient with new innovative therapies, but also supporting cancer patients through their treatments, as well as looking at research, new technologies that can enable us to enhance the care of our patients and our performance as care members and part of the cancer team. Recently, about 5 years ago, we offered a second conference in the fall, the Practice Management Program. And this is solely focused on areas of expertise and areas of need relating to managerial responsibilities and implementation of policies, procedures, and programs within the healthcare setting, be it an inpatient pharmacy, an outpatient infusion clinic, or other areas of ambulatory care. So this was an unmet need that we identified about 5 years ago to support the clinical managers, the directors of pharmacies with implementations of new initiatives, new policies and procedures, how to support their staff in caring for cancer patients and justifying new positions. In addition to our professional development, we also have professional tools and resources, which is something relatively new in the past year or two. We are creating an online repository on our website, which is at hoparx.org, to support our professional colleagues in caring for patients. Most recently, we completed a Time to Talk chemotherapy-induced nausea and vomiting collaborative with Eisai and Helsinn Therapeutics. This was a project that started about 2 years ago. We were approached by these companies to explore ways that we can educate not only pharmacy professionals, but also the patients and their caregivers in understanding the need to treat chemotherapy-induced nausea and vomiting. We found that there were several myths out there, not only among patients, but also healthcare workers, that we needed to dispel in order to optimize how we care and how we help the patients through their chemotherapy and trying to ameliorate the chemotherapy-induced nausea and vomiting that they will sometimes experience. We also are looking at oral chemotherapy, so we have a task force that's looking specifically at tools and resources to help people understand why these therapies are so important, to help them understand why adherence can optimize the outcomes for the patients. So as we know, more and more therapies are becoming orally available, more and more therapies are being delivered outside of the healthcare facility. That puts a lot of responsibility on the patients and their families and caregivers. So we want to be able to help our pharmacy professionals then in turn educate these families and educate the patients as they go home and they are getting their care outside of the healthcare facilities. So those tools and resources should be coming online soon, probably within the next 2 or 3, 4 months into the spring to look at ways that people can understand adherence and understand ways that they can educate their patients more effectively. We have journal clubs as well. That's another way we educate our members. We have these routinely throughout the year, offering them about 9 or 10 months out of the year. And it's a great way for our pharmacy trainees, in particular our residents, to have an opportunity to present to their peers and their colleagues. So that is something that's freely available to anyone, regardless of membership. A third area that we have is research. So we have been predominantly focused on the research of translational research, as well as maybe some of the clinical outcomes. We are now looking into expanding our research focus to go beyond that and looking at patient safety, looking at ways we can optimize the care of cancer patients so that in turn we can justify our roles as integral members of the healthcare team. So we recently started a subcommittee of research professional, the tools and benchmarking aspect, so we can provide to our membership ways that they can justify their own jobs, as well as going in and looking at justifying new positions as they grow and expand their cancer services within their facilities. The fourth area that we focus on is advocacy. We have to obviously stand up and be able to justify our positions not only to our colleagues within our facilities, but also across different stakeholder organizations, and most recently at the national and federal level, we are involved in trying to pass legislation that would recognize pharmacists as healthcare providers. So we call that provider status in the United States. So that's a really exciting opportunity for us to really become involved on the national stage and getting this legislation passed through. We of course have a patient focus. So part of our advocacy efforts is also working with patient advocacy groups to really help them identify opportunities for pharmacists to educate those patients that they have as their customers per se.